will come to order. A quorum is present. Without objection, the chair is authorized to declare a recess at any time. Since we are working in a virtual format today, I'd like to go over a few housekeeping items before we proceed. First, if you're experiencing connectivity issues, please make sure you or your staff contact our designated technical support so it can be resolved immediately. Members participating remotely must continue to use the video function for the duration of their participation in the hearing unless they experience connectivity issues or other technical problems that render the member unable to fully participate on camera. It is committee policy that members will remain muted when not recognized, just like turning off your microphone on and off during a hearing in person. This is out of courtesy to all members on this committee, and so that background noise does not interfere with another member who is recognized to speak. When you are recognized, you will need to unmute your microphone and pause a couple of seconds before speaking so that we will be able to hear everything that you say. If you wish to be recognized, please raise your hand using the Zoom raise hand function, unmute your microphone, and ask to be recognized. In order to ensure everything members say is captured on the live stream of this hearing, I ask that members pause for 2 to 3 seconds before beginning to speak. If you wish to have a document inserted into the record, please ask for unanimous consent and have your staff email the document to veteranaffairs.hearings@mail.house.gov. It will be uploaded to the committee document repository. Please keep in mind that you will need to refresh the repository page as it does not automatically update. For questioning witnesses, this makes it easier for me to make sure all members participating have an opportunity to be recognized. Does any member have a question about the conduct of this hearing with members participating remotely? Seeing none, I now recognize myself for an opening statement. Vet centers were first established as a part of VA by Congress in 1979 in recognition that many Vietnam-era veterans were experiencing readjustment problems and were wary of and or geographically far from large VA medical centers. In the decades since then, the Vet Center program has increased its footprint across the country, and Congress has expanded Vet Center eligibility to more veterans, service members, Guard and Reserve components, and family members. Vet centers are designed to be supportive, non-medical settings close to home, where veterans can get counseling to ease the transition to civilian life and process any challenges they experience during or following their military service. Individual, group, marriage, and family counseling is offered in addition to referral and connection to other VA or community benefits and services. Most Vet Center staff are veterans themselves. Our focus today is to determine whether vet centers are meeting current demand for high quality, timely care, and whether VA is appropriately planning for expansion to meet future demand for vet center services. I think it's important that we talk about finding the right balance that keeps the autonomy and more informal culture of vet centers intact while being systematic enough in collecting data to ensure that VA knows when and where to invest more staffing and other resources. Veterans, service members, and their families are overwhelmingly satisfied with their care at vet centers, which means that vet centers and VA central office are doing something right. We just want to make sure VA can identify where the needs are and meet those needs without being too heavy-handed in ways that backfire with vet center clients. Let me just repeat this. We just need to make sure that VA can identify where the needs are and meet those needs without being too heavy-handed in ways that backfire with vet center staff and clients. VFW testified that we need to be mindful not to push vet centers to their limits with regards to enough staffing and resources, and I certainly agree. Staff needs to always be able to be there for their client in the moment they are needed, for as long as they are needed. This cannot be lost in new staffing models. We'll hear from VA leaders of the Vet Center program, as well as Vet Center director who could speak to operations on the ground. When Secretary McDonough and I visited Ms. Hinton McDonald's Vet Center in Ventura, the secretary encouraged her to be very open with him about any challenges she and her staff are experiencing, and I encourage her to do the same today. We can't fix what we don't know, and your on-the-ground experience is certainly invaluable. We'll also hear from VA's Office of the Inspector General and the Government Accountability Office, both of whom have released recent reports on vet centers and made recommendations to further strengthen staffing and operations. We also are pleased to have representatives from veterans and military service organizations with us to share information about their members' use of vet centers and recommendations for improvement. All of our witnesses will testify to the importance of vet centers and complementing VA medical center care. So it's vital that we get this right, especially now when all of us need to support each other through the pandemic and the resulting isolation so many are experiencing. It has never been more important to increase rather than cut back on the multiple ways we provide veterans, service members, and their families with mental health support. With that agenda before us, I'd like to now recognize Ranking Member Bergman for any opening remarks he may wish to make. General Bergman.
Thank you, Chairwoman Brownlee, and thanks to everyone for taking this time, quality time, if you will, to have the discussion today that we're going to have. I'm grateful for the opportunity to be here, although virtually. I'd much rather be there in person with all of you to discuss such an important topic. Because of the fact, let's face it, veterans at risk probably are going to do better with their results when they're eyeball to eyeball. Preventing suicide and promoting mental health and wellness among veterans is one of my, and I know as well as your, highest priorities. One of my proudest accomplishments in office is getting the IMPROVE Act signed into law last Congress to make it easier for veterans who are at risk of suicide to get the support they need close to home. That is vital, given that most of the veterans and service members who die by suicide have not had contact with the VA healthcare system in at least 2 years before their death. If veterans don't, won't, or can't come to the VA will have to come to them. And VA can do that by expanding the reach of the VA healthcare system beyond VA medical centers and clinics and making it as easy as possible for veterans to get support in their own communities. Vet centers have performed that role beautifully. Vet centers were established by Congress in 1979 to provide readjustment counseling to Vietnam-era veterans who were reluctant to go to VA hospitals because they were understandably wary of government assistance and worried about the stigma that would follow. They would follow them forever if anyone knew that they were seeking mental health care. That still exists today. I have a vet center in my district in Traverse City, Michigan, and I know that they do life-saving work for my veteran constituents and their families. I want to see the vet center program succeed. And I want to see vet centers expanded to help even more veterans, service members, and their families. But I have some concerns that I hope will be addressed during today's hearing. One of those concerns is the role that vet centers play in the larger VA healthcare system. Vet centers were designed to be located away from VA medical center campuses and to offer confidential care to the veterans and service members who seek them out. That is a central function of vet centers and part of their success. Yet over time, I fear that that has led to a dangerous disconnect between vet centers and other VA medical facilities. Vet centers have a key role to play in stopping veteran suicide and are a critical access point for veterans struggling to cope with civilian life. They should be fully integrated into the mental health and suicide prevention efforts the rest of the VA healthcare system is undertaking as an equal partner, not treated like a distant relative. Recently, the Government Accountability Office and the VA Inspector General have assessed vet centers and found them lacking in several areas. Those include training and supporting vet center staff, addressing deficiencies with respect to quality control, and coordinating with other VA medical facilities about high-risk veteran patients. VA must do better. Veterans, service members, and families are all counting on it. I am grateful to each of our witnesses from the IG, the GAO, and the Veteran Service Organizations for being here today to tell us how vet centers can turn the corner for more positive results. And I'm grateful to our witnesses from VA, who I hope are going to tell us how VA has already started that mission. With that, Madam Chairwoman, I yield back.
Thank you, General. And now I'd like to introduce our witnesses. First, we have 4 witnesses from the Department of Veteran Affairs. Mr. Michael Fisher, Chief Officer of the Readjustment Counseling Service, will present the agency's testimony. Mr. Fisher is accompanied by Dr. David Carroll, Executive Director of the Office of Mental Health and Suicide Prevention, Ms. Gillian Hinton McDonald, Director of the Ventura Vet Center, which is in my district, she's the Director of the Ventura Vet Center, and Dr. Al Ozanian, Deputy Chief Officer of the Readjustment Counseling Service. When we get to the question period, members may direct questions to any of our VA witnesses. So we'll begin. Mr. Fisher, you have 5 minutes to present your testimony.
Great, thank you. And good morning, Chairwoman Brownlee, Ranking Member Bergman, and members of the subcommittee. I appreciate the opportunity to discuss the readjustment counseling services available at vet centers. I am accompanied today by Dr. David Carroll, Executive Director, VHA Office of Mental Health and Suicide Prevention, Gillian Hinton McDonald, Director, Ventura Vet Center, and Dr. Al Azanian, Deputy Chief Officer, Readjustment Counseling Service, or RCS. We are grateful for this opportunity to discuss vet centers, of which a core value is to promote access by overcoming barriers that may impede veteran service members and their families from using these services. Vet centers are an integral part of the VHA comprehensive service delivery system and play a unique role in helping eligible individuals easily access needed readjustment counseling and overcome barriers to other resources within VA and their communities. Vet center services are designed to provide non-medical readjustment counseling to eligible individuals who served in combat operations, areas of hostility, stateside deployments, or endured other military service-related trauma. The culture and environment of vet centers and the military and trauma-informed training and experience of our staff allows for a supportive community that is non-stigmatizing, builds trust, and is conducive to meeting the needs of our clients. Vet centers are by law situated apart from VA's general healthcare facilities and follow strict confidentiality practices. This model has been proven over time to have a significant and positive impact on the overall well-being of those we serve. Readjustment counseling is provided through 300 vet centers, 23 vet center outstations, over 1,000 vet center community access points or CAPS, and 83 mobile vet centers. These delivery sites are available in every state, the District of Columbia, and all U.S. territories. RCS uses a demand model to determine the appropriate asset type, service location, and subsequent staffing that incorporates the unique service demand for each community. This model allows flexibility for vet center staff to provide services in high demand areas, support growth, and shift resources as demand changes. RCS completed work on a vet center specific demand forecasting model in December of last year and intends to use these projections to improve planning related to future utilization, resource allocation, and budgeting requirements. In fiscal year 21, RCS streamlined a process for opening new locations to allow for more rapid expansion in areas of high demand and received approval to add 4 new vet center outstations in Saipan and the Marianas Islands, Solano County, California, Leesburg, Virginia, and Sierra Vista, Arizona. Additionally, just last week, RCS received approval to establish an additional vet center outstation in St. Cloud, Minnesota. Mobile vet centers, or MVCs, are used to take services to communities that are distant from other RCS assets. Mobile vet centers, or MVCs, are versatile, highly responsible, and represent effective and impactful outreach and direct service platform. They also provide support for VA's preparedness to respond to emergencies. In fiscal year 21, MVC teams completed nearly 90 deployments for emergency response and COVID vaccination efforts, providing support to over 14,000 veteran service members and their families, to include U.S. Capitol Police officers. Vet center stakeholder input is essential in ensuring quality readjustment counseling. In fiscal year 21, RCS, in partnership with VA's Veteran Experience Office, implemented Veteran Signals, or V Signals, throughout vet centers. V Signals provide real-time customer feedback and service recovery and will improve our ability to meet the needs of individuals served. Since July of 21, RCS has received over 19,000 responses, resulting in over 92% of individuals reporting to trust vet centers to improve their quality of life. Over 95% of new clients and established clients reported they were able to get an appointment in a reasonable amount of time, and almost 97% of new clients reported that vet center staff made them feel welcome and safe. RCS is committed to providing quality readjustment counseling and enhancing the well-being of veteran service members and their families. We appreciate Congress's continued support of this vital service. And Chairwoman Brownlee, this concludes my testimony. My colleagues and I are prepared to answer your questions.
Thank you very much for that. And next we welcome Dr. Julie Kroviak. She is the Deputy Assistant Inspector General for Healthcare Inspections at VA's Office of Inspector General. Dr. Kroviak, you have 5 minutes.
Thank you.
Welcome.
Thank you so much. Chairwoman Brownlee, Ranking Member Bergman, and subcommittee members, thank you for the opportunity to discuss the Office of Inspector General's oversight of the Vet Center program. The OIG's Office of Healthcare Inspections recently initiated a new line of cyclical inspections examining vet center operations to build on our years of conducting reviews that examine access to quality mental health care, particularly for our high-risk veterans. These new inspections seek to ensure that vet centers deliver safe, effective mental health care that follows VHA guidance, and most importantly, that vet centers collaborate with VHA facilities as required for high-risk veterans with complex mental health conditions. Like our Comprehensive Healthcare Inspection Program, or CHIPS, our vet center inspections are focused on specific areas that influence the quality of care: leadership and organizational risk, COVID-19 operations, environment of care, clinical and administrative internal oversight reviews, training and supervision of staff, and of course, suicide prevention activities. In terms of leadership, we found district, zone, and vet center leaders were engaged and supportive of a client-focused culture. All vet centers we inspected showed a commitment to delivering care during the pandemic, and we commend the staff for such dedication. Most of our recommendations focused on 3 areas: staff training, quality and administrative reviews, and critical activities aimed at reducing risk of suicide and supporting those most high-risk clients. First, at the 20 vet centers inspected, the OIG found suicide prevention training was completed at only 4 centers for all clinical staff and at 12 centers for all non-clinical staff. We also found only 4 of 20 vet centers documented that clinical staff completed military sexual trauma training. Second, the OIG found most vet centers completed annual clinical and administrative quality reviews. However, OIG teams could not assess leadership involvement in remediation plans due to incomplete documentation. Evaluating the quality of care and identifying improvement opportunities when a client attempts or completes suicide is not only crucial to reducing the risk of other suicides, but a district and zone leader requirement. Yet we found that only 23 of 53 completed suicides and serious suicide attempts had these completed reviews. Additionally, we could not confirm all vet center leaders conducted the required monthly client audit charts on 10% of each of their counselors' clinical caseloads. Regardless of the care setting, a client's true risk cannot be assessed without a thorough evaluation. Document assessments, including suicide risk assessments, help provide a comprehensive picture of immediate treatment needs. OIG teams found substantial noncompliance with the documented completion of these assessments across all inspected vet centers. Finally, as I previously described, communication and collaboration between vet centers and VHA facilities is essential for veterans deemed high risk or in crisis. To improve access to VHA high-risk flag information, RCS created a SharePoint site accessible to vet center directors, which houses an updated high-risk suicide flag list. Vet center directors must review this site and their client case list monthly to determine what interventions or support is needed. We found that 15 of the 20 vet centers completed this required RCS SharePoint review. Vet center staff must be able to access and coordinate higher level clinical care when necessary, yet we found that not all vet centers consistently did so. This process must be formally defined and consistent to ensure compliance and efficiency. While vet centers reported good relationships with their local suicide prevention coordinators, only 3 of the 20 vet centers had a standardized communication process. Additionally, we found that not all vet centers consistently consulted or coordinated with VA medical facilities on shared high-risk clients. With suicide prevention being VA's top clinical priority, vet centers are critical partners in reducing the risk of suicide, and vet center leaders must ensure staff are ready and able to meet the needs of these high-risk veterans. Our findings show that immediate attention is needed in several critical areas that will ultimately support suicide prevention efforts. Today's hearing should help draw attention to these issues for other vet centers as well. The findings and recommendations from our initial reports should serve local and national vet center leaders as an initial roadmap to improving and enhancing the services they provide every day. As with all of our oversight products, we will closely track open recommendations and action plans to ensure the intent of the recommendations are met and the improvements are sustained. Chairwoman Brownlee, General Bergman, and members of the subcommittee, this concludes my statement, and I would be happy to answer any questions you may have.
Thank you, Dr. Kroviak. Our final witness for this first panel is Ms. Sharon Silas. She's director of the healthcare team at the U.S. Government Accountability Office. You have 5 minutes for your testimony. Welcome, Ms. Silas.
Thank you. Good morning. Chairwoman Brownlee, Ranking Member Bergman, and members of the subcommittee, thank you for the opportunity to be here today to discuss the VA's vet centers. Vet centers are an important tool to reach and assist veterans in successfully transitioning to civilian life or to continued military service. My testimony today includes information on the status of recommendations from prior work on vet center staffing and counselor productivity expectations, and preliminary observations from our ongoing work reviewing how vet centers ensure they are meeting the needs of veterans and service members and their families. In 2021, 300 vet centers located across the United States provided counseling services to over 107,000 clients. Vet centers provide flexibilities in accessing mental health services that are appealing to certain veterans and military service members. Vet centers are community-based and offer a range of mental health services in a variety of settings such as group and individual counseling. In certain populations, for example, Vietnam veterans who may suffer serious mental health issues such as substance abuse or PTSD and who may be at risk for suicide may be reluctant to receive mental health services through a VA medical center. Vet centers provide a non-institutional access point to receive mental health care. However, successfully meeting the potential demand for vet center services requires effectively managing vet center resources, such as staffing, and effective outreach to potential populations who could benefit from vet center services. Our recent and ongoing work provides some insights into VA's vet center operations and efforts. In 2020, we reported on expectations for counselor productivity and vet center staffing. First, we found that although most counselors met the productivity expectations, some said that the expectations led them to change work practices that could negatively affect client care. However, RCS had not conducted an evaluation of the productivity expectations to identify any unintended or potential negative effects. Subsequently, we recommended that RCS evaluate productivity expectations for counselors and to develop a plan for periodic assessment of expectations as appropriate. We also found that RCS was developing and planning to implement a staffing model to identify criteria for determining staffing needs. However, we found the model did not fully incorporate key practices, such as including key stakeholders like counselors, or not accurately capturing the full scope of vet center work activities. Further, there was no plan to assess and update the staffing model regularly. For our 2020 report on vet centers, we made a total of 4 recommendations to improve vet center operational processes. And while VHA has made some progress in addressing these recommendations, all 4 recommendations continue to remain open. For our ongoing work, GAO is currently reviewing vet centers' efforts to ensure clients' needs are being met, outreach to potential clients, and any barriers veterans or service members may encounter in receiving care. Based on GAO's ongoing work, I'm prepared to share some preliminary observations. First, vet centers collect some information on individual client needs and whether those needs are being met throughout the course of treatment. For example, individual clients each receive a psychosocial evaluation at intake, and then their progress is assessed at each subsequent visit. However, our ongoing work suggests that aggregate information across vet centers and assessment of differences across different subpopulations may help to better inform whether clients' needs are being met. For example, Vietnam veterans may have different needs than those who served in more recent conflicts like Iraq or Afghanistan. Our ongoing work also shows that in conducting outreach to potential clients, vet centers engage with community stakeholders such as VSOs and review census data. However, we heard from some of our selected vet center sites that additional information could be helpful to better tailor outreach to specific populations. Lastly, our ongoing work at vet centers shows that RCS has taken steps to address barriers to care, such as building awareness of vet centers and addressing transportation challenges for clients. For example, vet centers have taken steps to address client transportation challenges by encouraging the use of telehealth. Other barriers vet centers face in providing care, including obtaining clinical consults from VA medical centers to discuss clients with more complex cases. In closing, vet centers can be a tremendous tool and play a pivotal role in successfully reaching and delivering quality mental health care to veterans and service members and their families as they adjust to civilian life. Effectively addressing both sides of the equation can help vet centers achieve their full potential. For vet center operations, ensuring staffing and counselor productivity expectations are aligned with meeting clients' needs, and for meeting demand for mental health services, conducting effective outreach to potential clients, and proactively addressing barriers in accessing vet center services. This concludes my prepared statement. I'm happy to answer any questions that you might have. Thank you.
Thank you, Ms. Silas, and thank you all who testified this morning. And I will now recognize myself for 5 minutes for questions. First, I wanted to go to Ms. Hinton McDonald. I want you all to know that she does a terrific job in the county of Ventura, the city of Ventura. We're very, very lucky to have her. And I want to thank her also for showing Secretary McDonough and me your vet center when we visited your facility late last year, just a few months ago. We heard from your VA colleagues earlier that updated monthly lists of clients with high-risk suicide flags are now being pushed out from central office to each vet center. I just wanted to confirm with you that you're getting those lists now.
Good morning, Congresswoman Brownlee. Yes, we are receiving the high-risk flag SharePoint list. I believe we've been doing it for close to a year now.
Very good, very good. Glad to hear it. So can you also give us a sense about, some of the other challenges you face, particularly in the area of coordinating and collaborating with, local VA medical centers? Obviously, everybody has sort of emphasized that, that intersection, is key to our success with helping our veterans, particularly around suicide. I just remember when we were there, the secretary and I were there, you actually mentioned that when vaccines were available for VA staff that, some of you weren't necessarily welcome and not included in terms of getting those vaccinations, which to me just sort of underscored perhaps, some level of disconnect in terms of the medical center and the vet center. So if you could just talk a little bit about that, I'd appreciate it.
So I can speak on my experience within my vet center and within interactions with GLA and referring. With the vaccine, I think that there's still room as RCS and vet centers are growing. There's still room for education within each individual service of what we do or who we are part of, meaning the healthcare administration. When we went to get the vaccine, they did not think that we worked for the VA. So that is something that is common. Within the consultation piece, it a lot of times relies on relationships within the different agencies. We're a bilateral relationship, so they're able to refer to us and we're able to refer to them. That doesn't have a specific consult system. When we have a need to reach out, we have our external consultant, clinical consultant. We have, again, our relationships with these different services like the mental health clinic at the Oxnard CBOC. But when there is a need to place a care in the community referral, or there's a need to place a referral to a more specific programming, sometimes that takes a little bit more effort because of the fact that we are having to have that through the surrogate in the back and forth. But I think that's something that's an improving relationship.
Very good. Mr. Carroll, do you have any response to what was just said?
Thank you, Madam Chairman. Very happy to participate in this, and we're working closely with partners across the organization, certainly with Mr. Fisher and his team, and that would include, directors like Ms. Hinton McDonald and our community care colleagues across VHA. I think this is we see ourselves as one system, and we want to have a seamless experience for veterans. And where there are issues for staff or for veterans, we're very interested in addressing those very quickly.
Thank you. Mr. Fisher, I have a little bit of time left, but I'm interested in hearing, about this new forecasting model that you have spoken about, and can you share a little bit about this? I am sort of more interested in how the model is going to guide you in terms of really full vet center expansions and where you need those. So if you could speak to that a little bit.
Yes, ma'am, and thank you for the question. This particular model takes our existing service utilization and also goes out and estimates the eligible population in given communities. It actually takes it below county level, so down into FIPS code, which is in between counties and zip codes. It then gives us information on the expected number of hours our staff would need to provide services in those communities to meet a need. And using that information as well as partnership with local stakeholders, we're going to begin to understand what is that need in that community. And then through focused outreach, as well as providing additional direct services, we are working to meet that need.
Terrific. Thank you. Thank you very, very much for that. And so we'll now move to General Bergman for 5 minutes of questions.
Thank you, Chairwoman. And I got 10 minutes of questions in a 5-minute time frame, so we'll get right to it. Mr. Fisher and Dr. Carroll, how does training for counselor, social workers, and other vet center staff compare to training for those same positions in VA medical centers and clinics? Are the requirements for training and quality the same? And if not, why not?
Sir, if I could start answering that question, the requirements to the talent management system, things like standardized suicide prevention, standardized training around military sexual trauma, those are the same across the VA enterprise. And I believe those were the things that the OIG was referring to in their report. We have worked to actually get access at the RCS level into that system so we can make sure our staff are taking those trainings and we're able to provide effective oversight. Addition to that, we RCS have also taken on a significant training initiative to make sure that we in our system can provide position-specific training to all of our staff to include evidence-based modalities, leadership development, as well as virtual clinical supervision for licensure across our enterprise.
Perfect, thanks. I know that because that's, we could talk about that for a long time and all the things you're trying to do to standardize where it's important. Mr. Fisher, if a community would like to see a vet center in their area, what can they do to demonstrate the need? What do they have to do?
Thank you again. I think the first thing is it's about connecting with our local vet centers so we together can go and understand the need in that community. We do that through partnership like focused outreach. And then it's about piloting counseling services in that community through the creation of a community access.
I'd like to get, because I'm going to go through these. I'm going to ask the question in a different way to be answered at a later time. Is there, for lack of a better term, a checklist that if a community wanted to get a vet center, they could start going down that checklist? Not to be answered now, but let me ask you another question. How long will it take to bring the 4 new service stations that were approved in fiscal year 2021 online? How long is it going to take to get them up and running?
Well, the services are already being provided in those communities. This approval really gives us access to the leasing process to create a permanent presence in those communities. For example, our outstation in Saipan, our counselor is already located permanently in Saipan now, providing direct services as we move forward through the leasing process.
Okay, thank you. Dr. Kroviak, your testimony states that, quote, vet centers rely heavily on engaged leaders at all levels, end quote. Can you elaborate on that and give any recommendations that you may have as to how VA could improve leadership engagement and consistency across vet centers?
Yeah, so I just want to say up front, the leadership engagement we describe in our reports was based on interviews. We were welcomed, leaders were cooperative, and everyone expressed commitment to improving the services they provide. However, you can see with the number of recommendations we're making, there are multiple opportunities for leaders to be more engaged in many of the operations of these service centers, particularly those that we cited in our report specific to suicide prevention activities. So it would be increased attention to everything we put out in our published reports.
Okay, thank you. And Ms. Silas and Dr. Kroviak, are you satisfied with the rate of progress you have seen from VA to date, addressing the recommendations from your reports on vet centers?
Sure. Thanks for the question. As I mentioned, for our prior work, we still have 4 open recommendations. We did receive some updates from VA last week, and they provided some documentation. One of the recommendations in particular, which was the recommendation to develop a plan for updating the productivity expectations on a regular basis. They provided a number of documentation. We're reviewing that, and we may be able to close that particular recommendation. But we'll have to see as they provide additional evidence whether we can close the recommendations out.
Thank you. And I take it for follow-up, Mr. Fisher. It would be great to see kind of a timeline as to when VA plans to fully address and close out the recommendations from the GAO and the IG. And with that, I yield back, Madam Chairwoman.
Thank you, General. And I now will call on Representative Connor for 5 minutes of questions. Excuse me. Excuse me, Connor. Representative Lamb.
Thank you, Madam Chairman, and appreciate our witnesses appearing with us today. I wanted to ask Dr. Kroviak, we in this committee have placed a lot of emphasis on vet centers as kind of a front line for suicide prevention. And it looks to me, the way I read your report, that you found problems on both sides of the equation of the vet center side and the VA side in terms of, the vet center side conducting critical incident reviews, doing patient lethality risks on their current people that they're dealing with. And then you also found that the VA is not updating lists of their own patients for vet centers to be aware of any high risk flags. Is that Is that a fair way of putting it, that you found on both the vet center side and the VA hospital or healthcare side that neither is developing or sharing the information as much as they should be?
So I think the fair way is to understand that we were looking at this from a vet center side lens and noticed there were some shortcomings on the coordination and collaboration in terms of information sharing, but all of our recommendations, or the majority of our recommendations, focus on that vet center participation side.
And is it both a failure to actually sort of ask the right questions and do the right interactions with the patient, and kind of a paperwork and record keeping and information failure, or is it more one or the other?
So it could all be pointed to a documentation failure. The record keeping system with RCS is quite different than VHA. So as an oversight body, we had a very difficult time determining which processes were being carried out in a timely manner and with what level of leadership oversight. So it was difficult to make concrete determinations. But if you're looking at training records as an example, I mean, these were pretty cut and dry, that they could not support documentation of completed trainings of their staff.
Did you get the feeling that the vet center leadership and personnel that you interviewed looked at suicide prevention as a key part of their mission and of the highest priority?
Absolutely. They are definitely committed to being partners in that role.
Okay, so if we maybe provide some more of the technical tools and leadership and requirements, and maybe formalize the processes, do you have confidence that we could improve some of the things that you found?
So I'd like our reports to be used as the tools. Quite frankly, if the 5 that we've initially put out are shared widely, those will be incredible tools for supporting and enhancing the services they're providing, and certainly used for expansion as well.
Great. And it did not look like your inspection included Pennsylvania, where I represent. Have you?
I'm assuming you finished your question. I'm sorry you froze, but I will tell you we will be in every district by the end of the fiscal year. In terms of which zones and vet centers we hit, we're hopeful within a 3-year cycle to hit all of them.
Excellent. I'm sorry. I think I just froze up on you on this end, but I caught the end of your answer there. So I very much appreciate your hard work on this, and we will definitely do what we can to spread your findings within the Pennsylvania region and make sure that we can keep improving in this important area. Thank you, Madam Chair. I yield back.
Thank you, Congressman Lamb. I now call on Congressman Rosendale for 5 minutes of questions.
Thank you so much, Madam Chair. Greatly appreciate it. Really appreciate all the panelists joining us today. Montana has about 10% of our population is veterans, so this is a very important issue for us. Mr. Fisher, I want to read you a text that I received from one of my constituents, and I'm going to keep out all the names and locations just so we can keep folks' information confidential. But this came from a mother. My son, the Marine, wrote you a letter, wrote it to me specifically, which I haven't in fact received that as well. He asked me to email it to you, but he really wants no one else to see his letter he wrote. It's too private to him. It's regarding his VA counselor being let go of his job due to failing some kind of a written test. I'm not sure of all the details regarding the test my son was referring to. His counselor is the only person that my son has shared his Afghanistan experience with. It's been amazing. My son is hoping that the counselor's job can be saved somehow. He needs this man's help. My son feels safe with this counselor. Once again, thank you, Matt. Mr. Fisher, in our second panel, one of the panelists is going to raise some concerns about credential requirements for the employees of the vet centers. And I just wanted to make sure I posed this question to you because I wasn't sure if you were going to be here during that panel. Some employees were trained before the establishment of the accrediting body, the Council for Accreditation of Counseling and Related Education Programs. But the panelists will state that these employees are not grandfathered in. Can you comment on how this issue of employee qualification is being handled, and tell us how you intend to balance the need for staff with these credentialing requirements?
Yes, sir, and thank you for the question. I believe what you're referring to is the difference between our hybrid Title 38 counselors, like social workers, psychologists, mental health professionals, as well as our Title 5 readjustment counselors. We've recognized in a standardization process these past 2 years that some of our Title 5 counselors were providing work that was really limited to by VA policy to our social workers and psychologists. Another way of saying that is that those Title V counselors were not protected if there were negative outcomes. So we made some adjustments into their job descriptions to make sure that they were providing the appropriate balance of services, to include that they were protected if there were any negative outcomes. To fix any of those situations, we've actually implemented or leveraged a current scholarship program that VA offers, where we can take our Title V counselors, if they get accepted to a particular school, and be able to award them scholarships to go back and get the appropriate degrees to then move into a hybrid Title 38 position. We have issued out so far 7 scholarships in this past year. We've also given every one of our Title V counselors the opportunity to submit documents into our HR office to be potentially converted over into a hybrid Title 38 series. For individuals that are working towards licensure testing, we also provide help, whether that is additional training, connection with mentors, to help them pass those state required licensing exams so they can meet the requirements of VA policy.
So do you have a record of the number of counselors that we've lost out of the system because of this new accreditation system?
I can't provide, I don't think I can get a number of counselors that we have lost. I think the message here is that RCS is getting in line with VA policy to make sure that we're protecting staff and providing the best possible counseling services to those that we provide services to.
And I understand that, but if you could, for me, please provide, when you have the opportunity to get back and provide the number of counselors that we have actually washed out of this system because they weren't able to fulfill those requirements. Additionally, I'd like to know, have we lost any counselors or other employees of the vet centers, or had their employment status placed in jeopardy because of the current vaccination mandates?
That is something I will have to take as an RFI, and we can get back to you with that information.
I would appreciate if we could have both of those, and I would think it's information that should be readily available in both. So if you could provide that within 2 weeks, that would be great.
Yeah, that's absolutely. My understanding is that we have not, but I just want to double check.
Thank you so much. And Madam Chair, I see my time has expired. I would yield back. Thank you so much.
Thank you, Congressman. I now call on Representative Levin for 5 minutes of questions.
Well, thank you very much, Chair Brownlee. Thank you for this important discussion today. Wanted to start with Mr. Fisher. Last Congress, I was proud to introduce something called the Vet Center Eligibility Expansion Act. This was a bill that I did with then Ranking Member Phil Rowe, and it became law in October 2020. Expanded vet center eligibility to National Guard or reserve members who were activated due to a national emergency or major disaster as declared by the president or under a governor in response to a disaster or a civil disorder. Mr. Fisher, I wanted to ask how this legislation has impacted your ability to care for service members who have responded to these crises across the country at unprecedented levels in recent years.
It's actually helped us immensely. In fact, after the Capitol riots, we were able to deploy mobile vet centers and counseling staff to be able to connect with the National Guard that was deployed or activated there, as well as the Capitol Police. Over the last fiscal year, we have provided about 1,000 encounters specifically to those groups at vet centers. As well as this has also allowed us to increase services to the National Guard, which we're seeing significant expansion into those particular individuals.
That's really encouraging. Thank you for sharing that. Dr. Kroviak, I wanted to turn to you. I understand OIG has released 5 reports from its new Vet Center inspection program, with more to come. And each of these reports examines a specific geographic region. I'm interested in the overlap. What are the most common themes that you found from these reports, and which recommendations are most urgent for the readjustment counseling service to implement overall?
So without a doubt, the most urgent recommendations relate to that collaboration and coordination with VHA clinical services for the high-risk veterans. We consider those most critical to all vet center directors, regardless of the site that we inspected, to take those seriously and do an internal assessment to see where they stand on those risks.
Thank you very much for that. And Ms. Silas, a couple questions for you. I noticed in your testimony that just last month, VA officials provided GAO with updates on its implementation of the recommendations from your September 2020 report. Can you clarify whether the readjustment counseling service was implementing these recommendations and communicating with GAO in a timely manner before this hearing was scheduled?
Certainly, yes. We actually reach out to VA to get updates on a regular basis on the implementation of our recommendations. So we try to stay on top of that to make sure that progress is being made. And they have been providing updates as they've been trying to make progress in implementing those recommendations and made adjustments to timelines as needed.
Thank you. And I believe in particular, GAO received details about VA's plan and timeframes for reassessing productivity expectations just last week. I understand that GAO is still reviewing this information, but can you share any preliminary findings with us?
Sure. They provided some documentation about their plans for the reassessment of the productivity expectations. They submitted a memo that seemed to outline how they were going to do that. We need to take a little closer look at that memo and look at some of the underlying evidence. One of the things, to get back to Ranking Member Bergman's question, is we do like to close out recommendations as quickly as possible, but they need to be properly implemented so we can actually see the affected change. So within the next week or two, we'll have an opportunity to look at the evidence they provided and make a determination. Yeah.
Fair enough, Ms. Silas. We'll look forward to following up with you on that. And thank you all for the work you're doing for our veterans. And with that, Chair Brownlee, I'll yield back.
Thank you, Mr. Levin. And I will now call on Congresswoman Miller Meeks for 5 minutes of questions.
Thank you, Chair Brownlee and Ranking Member Bergman. My question's for Mr. Fisher. Mr. Fisher, on the second panel, the VFW suggests that the VA consider using VSO posts as satellite vet center access points in line with Project Atlas. What do you think of the idea, and is it something that the department has considered previously?
Our community access points, which is places that we provide direct services anywhere from once a month to a couple of times a week through donated space. In those locations, we do leverage veteran service organizations as well as other places where we believe that veterans might frequent. So we're interested in any of those opportunities where we can get into communities that are distant from vet centers.
Yeah, being both a veteran and serving rural communities, it certainly would be beneficial in our area to save some drive time to have access, especially for those with mental health issues who may need some more immediate attention. You also has mentioned about the role of the vet centers and the VAs and that unique role that exists there. And the need to ensure confidentiality for vet center patients. And what are you doing to integrate vet centers with the VA medical centers and ensure that they're seen as equal partners in the VA's mental health and suicide prevention efforts? And then also, if you could address what you're doing to protect patient confidentiality against hacking, cybersecurity breaks such as that.
Well, if I can answer your second question first, and that is, our record system is separate from all other VA record systems and is behind the VA firewall. So we're able to leverage our IT partners to ensure that there is security, as well as we can ensure the confidentiality of those veteran and service member records from anyone else in the VA enterprise. The first part of your question, if talking in reference to collaboration, this is something that we're actually really excited about in working with Dr. Carroll's office. One of the things that we've implemented over the last several months is actually in partnership with site visits that the Office of Mental Health and Suicide Prevention are doing at every visit, where they talk through improvements in collaboration, improving services and things like that. There's actually vet center blocks of discussion. And from that, I've already completed 2 VISN site visits. We are engaging in meetings or in councils such as the mental health integrated clinical communities, where we can help focus on care coordination as part of the larger VA system. Dr. Carroll, is there anything you'd like to add to that?
Thanks, Mr. Fisher. Certainly, we have a strong partnership between our offices, but as you highlighted, it's not just at a national level. We have joint programs together around suicide prevention, around mental health, around training, around care coordination, where we bring people together to talk about expectations locally for clinical coordination, expectations regarding oversight and leadership in our integrated clinical communities that also include our homeless programs across the organization. And they bring together leaders at every level of the organization to work together to solve problems.
Thank you. And I know I'm almost out of time. So if you just kind of briefly answer this. Do you know how many referrals the vet centers receive from VA medical centers or clinics? And are you satisfied with that amount? And then are you satisfied with referring people who may need a higher level of care back to the VA medical centers?
The specific numbers, if we can take that as an RFI to make sure you have accurate information, I think there's always room for improvement in making sure that we have appropriate bidirectional referrals.
Thank you very much. And thank you, Chair Brownlee. I yield back my time.
Thank you, Doctor. And I will now move to Congressman Mervan for 5 minutes of questions.
Thank you, Chairwoman. Suicide prevention is a top priority for this committee and me. As chairman of the Subcommittee on Technology Modernization, I want to ensure we have the proper IT infrastructure in place to provide world-class healthcare and prevent suicides among our veterans. Mr. Fisher, I understand that readjustment counseling services is sharing information on patients with high-risk suicide flags at the vet centers. I appreciate the effort and dedication of VA staff in implementing this workaround, but this is a long-term IT solution. How can this process be improved?
I think the improvement happens through our current conversations with the updates to the electronic healthcare record. We have been in discussions about potentially moving to the Cerner platform, provided that vet center confidentiality remains intact. And there are proposals that are currently going through leadership concurrence and approval to see what the future of that would look like.
And then I am concerned that the OIG found substantial non-compliance among clinical staff in logging psychosocial assessments of suicide risk factors in the RCSNet. RCSNet is a web-based software that has been in use by the RCS for nearly 2 decades. How do you view OIG's findings, and do you believe upgrading the IT infrastructure could improve our compliance?
We're thankful for the findings from the OIG. I think this highlights some gaps that we know that we need to work on. I do believe that upgrading the IT infrastructure will be helpful. And some of the work that we're doing right now around responding to these is creating infrastructure to be able to give accurate information to our leadership to be able to provide effective oversight.
And then as a follow-up question, the OIG testified that only 4 centers were trained in the military sexual trauma. What are the plans in the future to be able to fulfill the obligations that all vet centers and staff are trained?
Yes, thank you for that question. This goes back to making sure that we are leveraging the infrastructure around the VA's talent management system, or TMS. Prior to this work, we were not a part or not able to validate information within that system within RCS. We do now have access and to be able to go in, not only assign training, but also to make sure that we can follow up and understand what's happening and what's not happening. That is separate from any of the other training initiatives that we are working on to improve services at vet centers.
Thank you, Chairwoman. I yield back my time.
Thank you, Mr. Mervan. I now move to Congressman Sablon for 5 minutes of questions. Mr. Sablon?
Yeah, good morning. Good morning, Chairwoman Brownlee, and good morning to all our witnesses. Welcome. I'm going to Mr. Fisher, again, my veteran service members and their families will appreciate the presence of a counselor in the Northern Marianas. I want to thank you for this. It certainly is a welcome development considering the staff from the Guam Vet Center were periodically visiting our islands to meet veterans. Could you in a short way explain the difference? What is the difference between a vet center and an outstation?
A vet center outstation is in a community where we assign at least one counselor to be able to meet the needs in those communities. It could be multiple counselors. A vet center, it provides different. The difference is that a vet center has more staff. There's also leadership at that staff. There's more infrastructure there.
All right, thank you for that. While the counselor is based on the island of Saipan, vet center services should be available to veterans and their families on the islands of Rota and Tinian. She will need resources to travel to these islands. Additionally, the counselor presently shares a workspace with an administrative staff, and veterans and their families cannot use this space to meet with the counselor or as a group. Mr. Fisher, would you tell me if you could confirm that the Saipan Vet Center outstation counselor will have sufficient resources to conduct outreach and see veterans, service members, and their families where they live, including on the islands of Tinian and Rota, and that the center will have its own space for the use of veterans and their families?
The answer to both of those questions is yes. We will make sure, and the plan has always been that counselor will be able to extend services and outreach into those distant communities, as well as we've already started the leasing process to find permanent space that is safe and confidential.
All right. Well, thank you very much for this, Madam Chair. I had yeses to all my questions, so I'm happy today. Thank you for this. Are you back?
Thank you, Mr. Sablon. We're glad that you're happy. And I will now move to Congressman Allred for 5 minutes of questions. Congressman?
Sure. Thank you so much, Madam Chair. And I want to thank our witnesses for the testimony. It's clear that vet centers provide vital support to our veterans for any issues they or their families are facing as part of their transition back to civilian life. And as part of the committee's ongoing commitment to veteran mental health, yesterday we marked up and passed the Strong Veterans Act, which included my bill that I've co-led with Representatives Peters and Mann to expand the peer specialist program. And I'm really excited for that program to work in tandem with the mental health services provided at vet centers to really elevate the resources available for our veterans. One part of that bill requires VA to hire peer specialists that reflect the diversity of the population that they serve, which I think is an important way to make sure that veterans feel comfortable and supported. And so, Mr. Fisher, I guess my first question is to you about what steps the VA is taking to ensure the diversity of its vet center counselors and that they reflect the population that they serve to the extent possible.
Yes, sir. Well, to answer that is that we hire staff that are representative of the communities they live in. I think about our outstations on the Hopi and Navajo reservations. Those staff are Hopi and Navajo. They speak the same language. The other thing that we look to hire is a large number of veterans who have shared experiences and are able to create that instant credibility.
That's good. Now I'll also ask you, can you expand on how VA is currently informing eligible veterans about vet center services? What has VA found to be the most effective way to reach veterans? How are we getting out the word about these centers?
Sure. So every vet center actually has outreach specific staff whose their focus is to go out and create face-to-face connections to create access to care. Those staff also go out and create community partnership that then leads to face-to-face connections. At a national level, we've actually just gone through a rebranding effort and also are working on creating more opportunities to get the word out with our partners in the Department of Defense and other places nationally.
Yeah. Well, I'm leading a bill, the Informing Vets Act, with my friend Anthony Gonzalez of Ohio, that requires VA to conduct an information campaign informing all veterans that are eligible of the Veteran Readiness and Employment Program to make sure that they know that they can take advantage of these benefits and understand what's available to them. And I'm wondering if this is a similar model that vet centers could take advantage of.
It could be, and I'm sorry, it could be, and we would welcome. Oh.
Okay, all right. Well, thank you for that. And Madam Chair, that's what I wanted to ask. I'll yield back.
Thank you, Congressman. I appreciate that. I don't think there are any other members who have questions. And so before we move on to the next panel, I just wanted to sort of conclude with, an issue that I continue to be concerned about. And that is, as we work to create staffing models, as we work to expand the enterprise of vet centers, which I believe we absolutely need to do as Congress continues to ask that different groups be able to go to the vet center. I just want, for Dr. Kroviak and Ms. Silas, who do some oversight of vet centers, and certainly to Mr. Fisher, that we all agree that vet centers are successful. And they're successful because, in large part because they're not the VA, and veterans and others, families, all feel more comfortable going to vet centers. And so as we look at these staffing models and we look to expand, I just don't want us to lose the reasons why vet centers are successful, that they are autonomous, and that we can't have these strict formulas that don't account for what counselors and staff need to do within these vet centers, because they really need to be there when they are needed. And we just always need to account for this. This is a different operation than other operations. And I just want everybody, to be well aware of that as we move forward. So I thank all of our federal witnesses today from the first panel, and certainly you are welcome, and would encourage you to hang on and listen to the comments and issues and concerns from the second panel. I think we can all learn from them, but I thank you very, very much for being here today. Your testimony has been very, very helpful. So I want to welcome our second panel of witnesses, each of whom represents a veteran service organization or a military service organization. It's vital that we hear directly from those of you whose members actually use vet centers. So we're looking forward to hearing what is serving you all well and where there may be opportunities for improvement. So we'll begin with our first witness, Dr. Thomas Hall, who is here to represent Vietnam Veterans of America. Because vet centers were first established to meet the needs of Vietnam veterans, it's important to us that you're here today to share your members' experiences with our vet centers. And I believe that this is your first time testifying before Congress. So welcome, a warm welcome to Dr. Hall. And you have 5 minutes to deliver your oral testimony. Thank you for being here.
Thank you, Chairwoman Brownlee, Ranking Member General Bergman, and the representatives of this distinguished committee. On behalf of the VVA National President, Jack McManus, and the membership of Vietnam Veterans of America, I thank you for affording VVA the opportunity to present our testimony regarding our views on the VA Vet Center. But first, I would like to insert a personal experience. Back in the early 1980s, when I was newly married, I had a discussion with my wife, and we were dealing with some challenges, and she said, Tom, you better take care of some of the stuff going on with you. So I went to the vet center and found it helpful. And I've gotten stories like that from people even today, that they find the vet centers were life-changing, helped them move from just surviving after coming back to beginning to thrive in the country. So I just wanted to pass that along about where I'm at on vet centers. I think they're great. I would also, VVA would like to thank the VA and especially vet center leadership and our representatives of Congress for the recent expansion of vet centers. More may be needed. I hear that some veterans are telling me that they are frustrated with being told that there's a 50-mile limit of some type for outreach as one of the concerns that they passed on to me. Another one was that veterans told me that the VA used to cross-coordinate with vet centers much better for assessment and diagnostic purposes. And now, at least from the veterans I've talked to point of view, there are impediments to being referred to the VA and then being able to get back to the vet center. The founding concept of vet centers was peer-to-peer counseling. Counselors in vet centers have been told that they were told to stop providing the level of service. I know Mr. Fisher has spoken to this, that they've been doing this for years because their certification of their accredited graduate school was not acceptable. We found that confusing in that there's a lack of eligible people and sometimes short staffing in some of the vet centers per what we're hearing. There was another issue that our members wanted brought up, and that was the issue of inconsistency of what is open versus suspended vet centers. The information that I got was that they would go up to a vet center, the counselors would be inside, the doors were locked, and they were told, well, they weren't really closed, they were just suspended, but they couldn't get in. I went to mine and didn't find that problem. On the point of being open, I have veterans asking when will continuing care again be reinstated, not only at vet centers, and I think that probably lends itself more to happening sooner, but at the VA to help manage the ongoing effects of PTSD. VBA is grateful for the work of vet centers in supporting survivors of military sexual trauma of all branches of service and their work in their suicide prevention. And believe me, we are very grateful. We support the development and the approval of a survey instrument to be used to gather anonymous counselor information. So how are the counselors that are there actually doing to address things like burnout? And finally, I want to thank the vet centers for piloting services to military personnel transitioning to civilian life. We found this a very difficult time for many people, and we're glad to hear that that's going on. We would hope that vet centers would also include the opportunity for veterans to help spouses living with someone with PTSD. The VVA thanks the subcommittee for this opportunity to present our views on how to support vet centers in meeting the needs of veterans and military personnel. And I look forward to answering any questions that you may have. Thank you.
Thank you, Dr. Hall. We appreciate your testimony today. And next we have Mr. Pat Murray testifying on behalf of the Veterans of Foreign Wars. Mr. Murray, you have 5 minutes for your testimony.
Chairwoman Brownlee, Ranking Member Bergman, members of the subcommittee, on behalf of the men and women of the Veterans of Foreign Wars of the United States and its auxiliary, thank you for the opportunity to provide remarks on this important topic. Vet centers are an incredibly valuable, yet oftentimes overlooked resource for service members, veterans, and their families. They were created in 1979, and between then and 2018, the number of sites have grown from 91 to 300. Today, vet centers assist hundreds of thousands of clients annually. Over the past 43 years, these services expanded to all combat veterans, active duty members, and their families. Therefore, all VFW members have been eligible to receive services at vet centers at some point in their lifetime. The VFW urges Congress to work with VA states, the United States Census Bureau, to calculate vet center usage along with veteran population and increase the number of vet centers. There are different ideas and calculations that could determine the best model for this expansion. And while the VFW does not have an exact formula in mind for the new coverage model, we do know more vet centers are needed. In addition, Congress must also ensure funding to cover the replacement of the aging vet center mobile fleet that provides a necessary supplement to the existing vet centers. These centers already serve a niche population, but there are other veterans, active duty troops, and family members that can benefit from their services. The VFW is encouraged by the proposals in Congress to expand vet center services to student veterans and family members of a service member of a veteran who died by suicide. However, with all expansions of eligibility, there needs to be an expansion of resources to handle the increased workload. Recently, a VFW auxiliary member reached out to our offices regarding a difficult experience at the vet center where they were receiving bereavement counseling. In the beginning stages, the auxiliary member's counselor was asked to inform the individual of other outside resources and mentioned that vet center counseling was only short term. Just months prior to this conversation, the individual was asked to cut down their sessions to every other week due to a waiting list and staff vacancies. Counseling is one of the very few actual services that VA provides to survivors. Responses like these are troubling to hear about. We must strive to remedy problems like this so individuals are never again turned away from services. Similar to other VA programs, vet centers need to be held accountable to providing their services in a timely manner within their mission. The VFW is grateful this committee is highlighting vet centers, and we have a suggestion to help promote that effort even further. HR 4601, the Commitment to Veterans Support and Outreach Act, seeks to push resources towards veteran service officers in areas where there is an increased volume in referrals to the Veteran Crisis Line. We recommend adding language to also include pushing resources to vet centers in these areas. Accredited VSOs do a fantastic job in assisting individuals to receive their earned care and benefits, but they're not mental health professionals. We appreciate the outside the box thinking in this bill, and we believe using this information to help identify areas of need and refocusing resources is important. However, we believe VSOs alone cannot accomplish that mission. So combining that with increased vet center resources, this effort can be achieved. Finally, as much as we urge Congress to provide additional resources, it is difficult to gauge what specifically is needed in order to accomplish this mission. Vet centers need a model on which to base their staffing and resource needs, but right now that does not exist. For example, VR&E counselors have a client to counselor ratio of 1 to 125. This helps establish what additional resources are needed for which specific VR&E offices. We believe vet center readjustment counselors should have a similar ratio in order to set expectations. The VFW strongly implores Congress to pass HR 3575, the Vet Center Improvement Act of 2021, which would evaluate productivity expectations for readjustment counselors and set guidelines for what type of workload each counselor should maintain. Once we have this information, we can more accurately identify what is needed in which specific location. Chairwoman Brownlee, Ranking Member Bergman, this concludes my testimony. Thank you for the opportunity to provide our remarks. I look forward to engaging in further discussions on this subject.
Thank you, Mr. Murray. I appreciate your testimony. And our final witness is Miss Renee Campos from the Military Officers Association of America. I'm really pleased that you're here to represent active duty service members who are eligible for vet center services, along with their family members and survivors. So welcome, Ms. Campos. You have 5 minutes for your testimony.
Chairwoman Brownlee, Ranking Member Bergman, and members of the subcommittee. The Military Officers Association of America, or MOA, appreciates the opportunity to share our views on how vet centers are supporting our service members, veterans, and their families. Up front, MOA's position is simply, we are very supportive of vet centers. As such, we urge Congress and VA to continue its ongoing analysis and oversight of RCS and vet center operations, and we ask for the requisite investment that's needed to successfully execute current and future missions. After almost 43 years, VA has done an exceptional job in promoting and expanding vet center capacity to meet increasing demand for these vital services in a way that honors and respects those that serve. I had the privilege in uniform at the Pentagon to work with RCS in the early years of OEF-OIF to provide bereavement counseling to surviving families whose loved one died on active duty. I saw firsthand the value of these centers and a proactive VA supporting both currently serving and veteran communities. Like many VSOs, MOA members, veterans, and their families tout the positive life-saving services delivered through the centers. One caregiver of a 100% disabled veteran told us that the VA Medical Center helped connect me to a vet center in my community. And I was so grateful to be able to talk with someone who understood what I was going through. The coping skills I learned helped me manage my stressors so I can be a better mom and a caregiver for my son. Now, while vet centers' value is well acknowledged, these centers face various challenges, and you heard those from the last panel. Additionally, we continue to hear from veterans who are not familiar with vet centers. Most learn about the vet centers from a VA medical facility or by word of mouth from other veterans. Another veteran told us that how it took her years to get a mental health appointment at VA, but all VA wanted to do was prescribe medication and send her to a vet center because the medical center was too busy to help her. She didn't want medication, and she certainly had no idea what a vet center was or how to access one. This was also a topic of discussion at a meeting last October of the VA Committee on the Readjustment of Veterans. Committee members indicated veterans need to know about the existence and location of these centers before they use them. There needs to be greater communication and outreach with VBA and VSOs to educate veterans on the role of these centers. During the meeting, VHA officials mentioned that veterans' access to care during non-traditional work hours remains limited. Another official voiced concerns over the possibility of expanding the aperture beyond what the centers could actually manage. It is imperative we keep our eye to the future so that the centers remain viable and that we do all we can to preserve their unique mission and presence in the community. As such, MOA recommends Congress enact the vet center provisions in HR 6411, the Strong Veterans Act. 2, that VA and Congress provide continuous oversight of vet center staffing and productivity, and to invest in personnel, funding, resources, and the infrastructure to do so. 3, VA further expand communication and outreach efforts to promote vet centers' mission and services across the enterprise. And this also includes with community partners and providers. Finally, VA must prioritize the expansion of non-traditional hours of operations to increase access to vet center services. Thank you for the opportunity to testify today. MOA commits to doing all we can to help Congress and VA enhance vet center operations, and I look forward to answering your questions. Thank you.
Thank you so much, Ms. Campos, for your testimony, and I thank the entire panel for being here today. And so we will move on to questions, and I'll recognize myself for 5 minutes. First, I wanted to go to Dr. Hall. Dr. Hall, you mentioned spouses. And I think you testified that they weren't necessarily allowed in vet centers. So I just wanted you to know that, if spouses, if they are determined that they need to be included to help the veteran, they are welcomed at the vet center. Spouses of deceased service members are eligible for bereavement counseling, and the Strong Act that we just marked up yesterday will also add family members of veterans who die by suicide. So, I wanted to make sure that you knew that, but I think the question is more about where you see the outreach of vet centers and actually the whole enterprise of VA in terms of their outreach to veterans to know, as we add new eligibility to vet centers, can you comment at all about, sort of how we're doing on that so that those who are eligible can seek help if needed?
One of the things in my local chapter that we experienced before COVID was that the vet center would send somebody over to the chapter to visit with the veterans that would come by there and offer an orientation to the services at the vet center. I think there's maybe some unmined areas. We have a thing in Kansas City called Tiny Homes Veterans Community Project, and they're opening up across the country. They've got about 4, maybe 5 different cities that they're opening up in, all veterans, all homeless, and probably in need of somebody stopping by and orienting them to that opportunity.
Great. And, Ms. Campos, can you kind of respond to that as well in terms of active duty members? I know particularly, I have spent a great deal of time on the committee to try to increase services for our women veterans, and certainly MST, sexual assault and so forth going on in the military. Sadly, it's more prolific than it should be, and we should have a zero tolerance atmosphere, and I believe we're improving in that area. But making sure that certainly active duty women know that they have access to vet centers, the doors open to them and welcome them if they're experiencing any kind of MST.
I would just like to start by saying that we have VSOs and military service organizations have had periodic briefs from RCS, and we appreciate that and appreciate the ongoing communication that Mr. Fisher and the other staff, in keeping us informed of what's going on in the vet centers and how we can engage. I do think that there is a lot of work that needs to be done. It's clear that VA as a whole across the enterprise could do a much better job on communicating the resources and services that they have available, and vet centers are no exception to that. There also is an opportunity and needs to be more communication between VA and DoD and what services are available. So I think there could be a greater amount of collaboration between both health systems and also with their community providers. Some of these folks will be seen in the communities. If they're Guard and Reserve, they're most likely going to get their care in the community. So I think it's essential that greater communication between the agencies on these services in both the Department of Defense and VA, but also making sure that VA resources like the vet centers are known and promoted.
Thank you so much for that. And Mr. Murphy, really thank you for your very helpful testimony. And when I hear testimony saying where, veterans have experiencing services that have been cut down or delayed is a big concern of mine, and that's why I sort of referenced some of your testimony and my opening comments today. And so this goes back to what my major concern is about, we need to expand services, which means we need to expand staffing. We need to keep vet centers a successful enterprise as they are, which means that, we need staffing models to know how we need to expand. That's critical, but I also don't want the staffing models to be such that it creates this, one counselor needs to see 10 veterans a day, and if they don't meet that criteria, then that's unacceptable. That's not where we want to go in this process. And so I guess I really don't have a question for you except to, keep us informed on this, because this is a real issue. I think that all of us agree upon, and certainly an issue that I want to keep an eye out on. So thank you for your testimony. And now I recognize General Bergman for 5 minutes of questions.
Okay, thanks. Again, I got probably 10 minutes of questions in a 5-minute time frame. So Dr. Hall, your testimony notes that vet centers were created to provide a pathway to care for Vietnam veterans who had had negative experiences with VA medical facilities. Do you think that is still an important function of the vet center program? Because now we've got Desert Shield, Desert Storm, we've got Iraqi freedom, enduring freedom. Pick your operations around the world that we have men and women who have served faithfully and diligently. So is that need for vet centers as important now as it was when you and I came back from Vietnam?
Well, again, thank you for your service. I didn't know you were Vietnam. I think I want to say that a warrior is a warrior, and what you go through in war, that really doesn't change all the way back from the Greek tragedies. It's something that it's going to change a person, and it's going to leave you with something to manage and to deal with afterwards, or it'll deal with you when we found that out. Many people are able to do that, and many people are able to do that with a little nudge and some assistance and some direction. And I think the vet center does that without immediately going to medication or to some kind of manualized treatment that they have to do, that they can come in and be with fellow warriors without and have people stop long enough to hear their story. The vet center can do that. And it's not a medical model. Medical model works very well. I get my health care at the VA here. However, I understand and respect and admire the work that we're doing in the vet centers, because it has the flexibility to reach out and to work with people in all different kinds of situations, different kinds of stories. And if they need the VA, that they can then orient them to a service there. When I said earlier that there seems to be a breakdown on the referral on assessment and diagnosis, it seems like they don't get to come back to the vet center, or they're told right away that they need this medication and given it, and without, I'm not exactly sure what they're experiencing, but I've heard it often enough. So the vet center.
The clock is ticking here, and I want to get to Mr. Murray and Ms. Campos. So
thank you.
Appreciate the thoughtful answer, and I appreciate the continued dialogue now that we've made a connection that we probably are both relatively the same age and probably have earned all the white hairs we have on our head. So having said that, Ms. Campos, your testimony states that MOA continues to hear from service members and veterans who are unaware of the services that vet centers provide. how do you think the VA could improve outreach to those service members and veterans and their families to ensure that every person eligible for a vet center is aware of their existence?
Thank you for the question. The first place is right with the with VA and across the enterprise at every touch point that VA has. So there is obviously a responsibility with the vet centers to do that, but again, there has to be, as I mentioned in my testimony, that people need to know what the vet center's roles are, what they do. And a lot of times you might just get said, told to just go to a vet center, but there really needs to be an explanation to veterans so they know what that means. So I think every touch point, and I think that the committee that I mentioned in my testimony talked about having VBA, VSOs, but also every aspect of VBA, even whether you're talking about home loans or whatever, every touch point that a veteran touches within the system, the employees and folks should be familiar with these centers and be readily able to refer them and explain what they do.
Okay, well, thanks. And Mr. Murray, because my time is just about up, let's plan on a future time to talk about your idea about expanding Project Atlas, because that's really probably, as far as I'm concerned, at least a half-hour conversation. So let's do that. However we do it, maybe a roundtable, Chairwoman Brownlee, on just specific the expansion of Project Atlas, because I think that needs to be a discussion for a variety of reasons that would be valuable to all of us. And I appreciate the future discussion on that, Mr. Murray. And with that, Madam Chairwoman, I yield back.
Thank you, General Bergman, and I will definitely follow up with you on that suggestion. I think we will now go to Congressman Mervan for 5 minutes of questions.
Thank you, Chairwoman. Dr. Hall, in your written testimony, you noted that the vet center should be educating MST survivors who were discharged with less than honorable conditions about VBA's character of discharge review program. In the VBA's view, do vet centers have adequate resources and staffing to do this effectively? If not, what's needed to strengthen such educational efforts? And do any of the other witnesses have views on this issue that they would like to share?
My first, when I first ran into this, I didn't know anything about it. The fellows that I talked to had been discharged because men and women, because they started trying to raise the awareness of their MST, and they just got diagnosed as personality disordered and then discharged out of hand. That to me was a problem and an area of challenge for us to correct. And I think that kind of attention to what's really happening there, I know it's been in the news, and the whole MST issue is huge. That is my concern, that the vet center allows both reaches out and makes themselves available, and they're doing more of that to people who might think they don't really deserve it or they can't access it. And I think they are in a unique position because of their profile, not a ginormous VA coming at somebody, to let people know that in their offices, whether it's verbally or through posters or handouts, that these things exist. And while they may not be in a position to do that because their clinical work takes a lot of time, they need to be able to. I used to say that I was only good as my referral sources, and for my clients. And I still believe that that's the important thing.
Thank you. Any other witnesses want to add to that? Okay. With that, I want to thank the witnesses for your testimony today, and I yield back my time to the chair.
Thank you, Congressman, and I will now recognize Congressman Rosendale for 5 minutes of questions.
Thank you so much, Madam Chair. Appreciate everyone joining us today. Dr. Hall, I don't know if you heard my comments earlier, but it was about a text that I had received from a Marine's mom. I've known this family, and were you able to hear that information?
Yes, that that a counselor had gone that he'd been working with and made a connection to, and she was concerned about his mental health now that he could not access that kind of support.
Very good. So my question to you is, do you believe that the VA is managing this accreditation transition adequately, and do you have any concerns about losing counselors?
Well, initially, I heard a number of almost 250 being suspended from providing the kinds of services that they had been doing. There's other people that are further down into the weeds about the detail on that, but that was the message I got in the field. So I was very concerned about being able to supply the kind of services that you're supposed to when you take a hit on that many people working for veterans. I don't know about the specifics of the individual, obviously, that you're referencing. My opinion is you never let somebody go. You leave no veteran behind. And no matter what, almost no matter what, as you know what I'm saying, that veteran needed to have continued follow-up and transition, at least to another therapist, where they understood that the person that he was working with trusted this therapist, and so the transition could be made strong.
Okay, I appreciate that. I really do. Mr. Murray, I've got really not a question, but just a statement really for you to solicit some information or help, to be honest with you. We need some type of data and statistics to support the number of vet centers that are needed so that we can establish some sort of a goal, at least to begin conversations. And when you say that we just need more, I need you to help me with that. Everyone knows we need more. These vet centers, everyone on this committee, we all agree to that. But leaving the answer up to folks that aren't professionals in the field, i.e. Congress, okay? You do not want to leave that up to us. As General Eisenhower said, farming looks awful easy when you live 1,000 miles away from a cornfield and you use a pencil for a plow, okay? So there's a whole lot of folks up here that are too far removed from this situation to be making those kind of estimates. So all I'm asking is that you can get us some kind of data and enlist the appropriate people. This is my request to you. Enlist the proper people, get us something, get us a target so that we can go ahead and have something to start having a discussion about. Thank you very much. And with that, Madam Chair, I would yield back.
Thank you, Congressman. And I don't think we have any other members online here to ask questions. I know today is a very busy day in Washington with hearings, and we're going to be, I think, voting all day long today too as well. So people are maybe preoccupied. But before we close, General Bergman, do you have any closing comments?
Nothing here. Thanks for everybody's time. And Mr. Murray, I look forward to that next discussion.
Thank you, General. And, I want to thank all of our panelists today. It's been extraordinarily helpful. And I think we all agree that we want to, build upon our vet center success. I know that we haven't covered today every single issue that was presented in your oral and written testimonies, but I certainly read all of your testimonies very, very carefully, and I think I have a good sense of the things that we need to be aware of, and appreciate it very, very much. And I really do look forward to being in close touch with all of you, so that we can really work together here to strengthen the Vet Center program by maintaining, high quality care, supporting our Vet Center staff, and I think, most importantly, really improving upon collaboration between the VA medical centers and the vet centers, and not having a too heavy hand on oversight. But oversight is important, but I think the VA centers have proven since 1979 that they've been extraordinarily successful. So, their autonomy, I do believe, is very important. So, and I know one issue that Ms. Campos, that you raised too, that I don't think that I have thought about as much, is really the coordination between the VA and DOD in terms of just, the outreach, particularly on the DOD side. And I think VA needs to do a better job on their side, but that outreach so that service members and National Guard and so forth understand that they have access to the vet centers, and they should use them. And because people are during their service, they might not be on the battlefield, but there are, particularly like MST and others, but there are issues that can be dealt with at vet centers, and can help our armed services, across the country to be better prepared and better ready. So I want to thank you all again for today's testimony. I thank the first panel for their testimony, and with that, I think I need to say that all members will have 5 legislative days to revise and extend their remarks and include extraneous materials. And with that, this hearing is adjourned. Thank you.